Hey, I'm Dave Fannin with the Body Form Personal Training Fitness Bootcamps, and what I wanted to talk to you today about is 6 tips to relieving muscle soreness. Quite often when clients that come into me, they've either not worked out for, sometimes a decade or a few years or ever, and the first workout can be quite surprising the next day. So, and I always warn them, there's 1,000% chance of soreness in your future. And even when we take people in that have been running or doing other forms of exercise, just changing your environment and changing who you're working with, and usually the intensity goes up a little bit, which is what they're looking for because they're not able to hit that workout hard enough on their own. It changes and they get that next level soreness. But quite often the soreness that you're always thinking about is that very first day where you're returning from a program from year layoff, or you've been ill for some time, or taking a break for 6 months or so for whatever reasons. That first day or the next day can be quite disconcerting, and for brand new people it can be demotivating. And oh my God, am I going to feel this way all the time, and is this the way it's going to be, and this is crazy and I don't want to do this. And so I have to kind of like calm them down and get them off the edge of the cliff, and get them through that next day. And that's usually why we schedule the first 2 days back to back if we can, to get them moving and just reassure them that this is normal. It's a side effect, not a goal. But getting through that soreness, and then you just start feeling better. Then you start feeling like you can accomplish things and you can move forward. So the number one thing very in the beginning is, cold packs, reducing inflammation, reducing temperature. An ice bath, which is kind of advanced for newer people, but if they're not feeling things quite right, we want to get relief of reduce the temperature, reduce the inflammation. Cold packs on the muscles that are hurting the most. Usually in the beginning, on the first couple of days, it'll be the thighs or the back of the arms, those big movers where they're just pushing, and the legs will usually hurt a lot because people are just literally like walking to their car and driving to work and getting out of their car and walking to their job and sitting down. They're not standing up and sitting down. They're not squatting very often. So those things are going to be sore. And they're big muscles, and the bigger the muscle, the more stress you're going to kind of build up on that first day. So relieving inflammation, cooling down those muscles, number one thing. And this is the order that I would recommend. There's 6 of them. Number 2, ibuprofen. Man, it will take the edge off. And for most of my clients over 35, we just say, hey, take a couple of tablets of ibuprofen before you come in. If it's not contraindicated for you. So, if your doctor says it's not a good idea for you, don't do it. But for most of my clients, it reduces the inflammation again, and we kind of use it as, ahead of time just to kind of get through it, and it helps like with joint stiffness, that sort of thing, and you feel better. It takes that one little bit of edge off where you can get down the stairs, you can sit down on the toilet seat and get back up, and those things help, and then you just start feeling better. Number 3, we recommend an Epsom salt bath if you're still sore. What the mechanism is I don't know, and I'm going to be straight up. Why does it work? I have no idea. Does it work? Yes, it does. You feel better when you put Epsom salt in warm or warm hot water. That's the goal. This is where we start getting into heat. You tend to feel better, and there's magnesium and sulfate. But all you have to know, it's like putting Bengay on a sore joint, where it doesn't actually help the joint, it irritates the skin, but you feel better. It has a bit of a placebo effect. Epsom salt will help you feel better and start drawing out some of that soreness. Again, start warming those muscles up. 4th, hot packs, a heating pad. Don't sleep on the thing, but getting some warmth on those muscles on that day 2 or day 3 and keeping them loose. Or by God, I never thought in Texas that I would want like heated seats in my car, but you can sit on those things and turn it and just, you're like, oh my God, that feels so much better. So, use heat to start loosening up those sore muscles. Not immediately. I don't usually recommend heat the first day after. I recommend it the 2nd and 3rd day. Usually trying to cool things down, just kind of like getting everything, all the inflammation out in the first day is important. Next is massage. And massage is very individual. Some people just don't like massage, and that's okay. It's not absolutely necessary, but it does tend to help those people that are enthusiasts for it get through those first couple of days and just loosen them up. And it's just, and there's a reason that high-level athletes and high-level amateur athletes use it for recovery, because it just loosens your muscles up, you feel better, gets you going through a full range of motion, and it's passive. You can relax, when it's done properly. And do find a good sports massage therapist and let them know that you're coming in from your first couple of days of working out, so they know specifically, what your goals are and what you're trying to get through. But that definitely helps that mechanical breaking up of the tissue, and you start feeling better. Then 6 would be exercise, because that's one of the things that I've noticed with my clients is, I try to get them in, that we train that first day, and if I can get them in the next day, because I have a system, especially for newer people that are new to exercise or just trying to, they're dropping a lot of weight, 20, 30, 50 or more pounds, of getting them through that first day of soreness. And I tell them, don't just sit at home, get out and walk at least 20 minutes if you can't come see me. You'll feel better. And now, your first inclination is like, I don't want to do anything more because, oh my God, I can barely move. But you'll feel better within 5 minutes. And you start moving all those trash products around, you start feeling better, you start clearing out of your system. And I do have a system that I work with people, because, I say, well, how do you feel? My legs, I can barely move them. We can start doing like small step ups, and just getting them moving on the treadmill and just moving and them not thinking about it tends to help things. And the idea is, that fine line of not making it worse, and we can do that. It's pretty hard to make it worse after that first day. But, easing into it, because you should not be so sore that, you feel like you have the flu. But you should definitely know what I try to get people, the level that we would like, which is, conservative, is, you did something different. You did something different. It shouldn't be like agony. That's, on a pain scale, it should be like a 4 or 5, not an 8 or a 10. And then, because then you're looking at, risk of damage to the muscle. So those are my 6 tips: cold, ibuprofen to reduce inflammation, Epsom salt, old home remedy, seems to work. Doctors recommend it. Then starting to apply heat, loosening those muscles up, massage, and then exercise. Then you'll feel better, and then you're on your way. And the soreness over time, when you do something new, it never goes away. When you push yourself a little bit more, it never goes. But you start to relate it to moving forward with your exercise program. So I hope this helps. Hope it helps you get through your first couple of days, especially, and know that good things are coming your way for making the decision to start exercising and eating better. And I'm Dave Fannin with the Body Firm Personal Training, Fitness Bootcamps. I'll talk to you later.